All right, John, thank you. Imagine waking up in the middle of the night and you can't move at all. You're paralyzed. For those who experience it, it is a very real and very terrifying experience. Dr. Joseph Ogile is a sleep expert from the Clayton Sleep Institute, here to talk about sleep paralysis. Good morning to you.
Good morning, Randy.
I remember when I was a kid having a dream about the boogeyman and I'm trying to run away and I can't. Is that the same thing, that you can't move in your dream? Or do these people that suffer from this actually wake up and are paralyzed?
Yeah, the sleep paralysis it's a little bit misnamed because it's actually not when you're asleep. It usually occurs in transitions from wake to sleep or sleep to wake. And it's normal in many people. So if you talk to folks enough, most people have experienced lying in bed and not being able to move. That's effectively sleep paralysis. It is also associated, not diagnostic, but it can be associated with things like narcolepsy.
No kidding. Now, is there something that happens to you physiologically? What happens to your muscles that you're not able to get the signal to the brain that says, move, get out of there?
Well, for instance, in REM sleep, your body is paralyzed except for your eye muscles and your breathing muscles. And so in these transitions, if you wake up and you happen to be in REM sleep, so that's that association with the dream that you were describing.
Right.
If you wake up during that period of time, sometimes there'll be a brief period of time during that transition when you will still be paralyzed like you were in REM sleep. And so it's very frightening for patients sometimes to have that happen. And so we have to explain to them about it. They sometimes can also have associated hallucinations as you go into sleep. We call those hypnagogic hallucinations. And if you're coming out of sleep, we call those hypnopompic hallucinations.
Wow, that sounds really scary. If I'm somebody at home and I'm watching this now and I've been experiencing this not knowing what was going on, and now they recognize what it is, what do they do to control it? Or if I'm sleeping next to someone with it, what can I do to help?
Yeah, the reality is it's not something that we are able to control per se. We educate folks about what is going on because, again, it is normal, or it's a normal variant in some people with their sleep. If it's associated with some of these other sleep disorders, then we talk to them about that, and we can treat those with medications.
What about long-term health effects or dangers to any of it?
There aren't any associated long-term health effects or dangers as long as it's sort of periodic, and most people don't have this every night, Randy. They'll have it occasionally. And if you sit, I know you like to talk about this at a cocktail party, but if you're a party and you talk to folks, they more than not will say they've had that happen to them. They just never talked about it before.
Wow, wow, it's really amazing, the statistics that come with it. If this sounds familiar to you, or if you know somebody who may be suffering from this, you might need the help of Dr. Ogile, and it might be the basis for an underlying problem. You never know. So check them out at the Clayton Sleep Institute. We've got a link to their website on our website, fox2now.com. Thank you, Doctor.
Thank you, Randy.
Awakening stuff, right, John?
Yeah, that's right.